Prometric Q&A and Rational 61-120. Part 1. 61. The client has elected to have epidural anesthesia to relieve labor pain. If the client experiences hypotension, the nurse would A. Place her in Trendelenburg position. B. Decrease the rate of 4 infusion. C. Administer oxygen per nasal cannula. D. Increase the rate of the 4 infusion. Answer is D. If the client experiences hypotension after an injection of epidural anesthetic, the nurse should turn her to the left side, apply oxygen by mask, and speed the 4 infusion. If the blood pressure does not return to normal, the physician should be contacted. Epinephrine should be kept for emergency administration. Answer A is incorrect because placing the client in Trendelenburg position, head down, will allow the anesthesia to move up above the respiratory center, thereby decreasing the diaphragm's ability to move up and down and ventilate the client. In answer B, the 4 rate should be increased, not decreased. In answer C, the oxygen should be applied by mask, not cannula. 62. A client has cancer of the pancreas. The nurse should be most concerned about which nursing diagnosis? A. Alteration in nutrition. B. Alteration in bowel elimination. C. Alteration in skin integrity. D. Ineffective individual coping. 62. Answer is A. Cancer of the pancreas frequently leads to severe nausea and vomiting and altered glucose levels. The other problems are of lesser concern, thus, answers B, C, and D are incorrect. 63. The nurse is caring for a client with uremic frost. The nurse is aware that uremic frost is often seen in clients with A. Severe anemia. B. Arteriosclerosis. C. Liver failure. D. Parathyroid disorder. 63. Answer is C. Uremic frost is most likely related to liver disease. It is not related to anemia, arteriosclerosis, or parathyroid disorders, therefore, A, B, and D are incorrect. 64. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include BP 80-34, pulse rate 120, and respirations 20. Which is the client's most appropriate priority nursing diagnosis? A. Alteration in cerebral tissue perfusion. B. Fluid volume deficit. C. Ineffective airway clearance. D. Alteration in sensory perception. 64. Answer is B. The vital signs indicate hypovolemic shock. They do not indicate cerebral tissue perfusion, airway clearance, or sensory perception alterations, so answers A, C, and D are incorrect. 65. The home health nurse is visiting an 18-year-old with osteogenesis imperfecta. Which information obtained on the visit would cause the most concern? The client A. Likes to play football. B. Drinks carbonated drinks. C. Has 2 sisters. D. Is taking acetaminophen for pain. 65. Answer is A. The client with osteogenesis imperfecta is at risk for pathological fractures and is likely to experience these fractures if he participates in contact sports. Answers B, C, and D are not factors for concern. 66. The nurse working the organ transplant unit is caring for a client with a white blood cell count of 450. During evening visitation, a visitor brings a basket of fruit. What action should the nurse take? A. Allow the client to keep the fruit. B. Place the fruit next to the bed for easy access by the client. C. Offer to wash the fruit for the client. D. Ask the family members to take the fruit home. 66. Answer is D. The client with neutropenia should not have fresh fruit because it should be peeled and/or cooked before eating. Any source of bacteria should be eliminated if possible. Answers A, B, and C will not help prevent bacterial invasions. 67. The nurse is caring for the client following a laryngectomy when suddenly the client becomes non-responsive and pale, with a BP of 90/40. The initial nurse's action should be to A. Place the client in Trendelenburg position. B. Increase the infusion of normal saline. C. Administer atropine intravenously. D. Move the emergency cart to the bedside. 67. Answer is B. The client's BP is low, so increasing to 4 is priority. Answers A, C, and D are not the first priority, therefore, they are incorrect. 68. The client admitted 2 days earlier with a lung resection accidentally pulls out the chest tube. Which action by the nurse indicates understanding of the management of chest tubes? A. Order a chest X-ray. B. Reinsert the tube. C. Cover the insertion site with a Vaseline gauze. D. Call the doctor. 68. Answer is C. If the client pulls the chest tube out of the chest, the nurse's first action should be to cover the insertion site with an occlusive dressing. Afterward, the nurse should call the doctor, who will order a chest X-ray and possibly reinsert the tube. Answers A, B, and D are not the first action to be taken. 69. A client being treated with sodium warfarin, Coumadin, has a Protime of 120 seconds. Which intervention would be most important to include in the nursing care plan? A. Assess for signs of abnormal bleeding. B. Anticipate an increase in the Coumadin dosage. C. Instruct the client regarding the drug therapy. D. Increase the frequency of neurological assessments. 69. Answer is A. The normal Protime is approximately 12 to 20 seconds. A Protime of 120 seconds indicates an extremely prolonged Protime and can result in a spontaneous bleeding episode. Answers B, C, and D may be needed at a later time but are not the most important actions to take first. 70. Which selection would provide the most calcium for the client who is 4 months pregnant? A. A granola bar. B. A bran muffin. C. A cup of yogurt. D. A glass of fruit juice. 70. Answer is C. The food with the most calcium is the yogurt. Answers A, B, and D are good choices, but not as good as the yogurt, which has approximately 400 milligrams of calcium. 71. The client with preeclampsia is admitted to the unit with an order for magnesium sulfate. Which action by the nurse indicates the understanding of magnesium toxicity? A. The nurse performs a vaginal exam every 30 minutes. B. The nurse places a padded tongue blade at the bedside. C. The nurse inserts a Foley catheter. D. The nurse darkens the room. 71. Answer is C. The client receiving magnesium sulfate should have a Foley catheter in place, and hourly intake and output should be checked. Answers A, B, and D are incorrect because they do not indicate understanding of MgSO4 toxicity. 72. The best size cathlon for administration of a blood transfusion to a 6-year-old is A. 18 gauge. B. 19 gauge. C. 22 gauge. D. 20 gauge. 72. Answer is D. D is correct because the best size cathlon to use in a child receiving blood is a 20 gauge. A, B, and C are incorrect because the size is either too large or too small. 73. A client is admitted to the unit 2 hours after an explosion causes burns to the face. The nurse would be most concerned with the client developing which of the following? A. Hypovolemia. B. Laryngeal edema. C. Hypernatremia. D. Hyperkalemia. 73. Answer is B. The nurse should be most concerned with laryngeal edema because of the area of burn. The next priority should be answer A, as well as hyponatremia and hypokalemia in C and D, but these answers are not a primary concern so are incorrect. 74. The client has recently been diagnosed with diabetes. Which of the following indicates understanding of the management of diabetes? A. The client selects a balanced diet from the menu. B. The client can tell the nurse the normal blood glucose level. C. The client asks for brochures on the subject of diabetes. D. The client demonstrates correct insulin injection technique. 74. Answer is D. The client with diabetes indicates understanding of his illness by correctly demonstrating the technique for administration. A, B, and C are incorrect because they do not indicate understanding. 75. The client is admitted following cast application for a fractured ulna. Which finding should be reported to the doctor? A. Pain at the site. B. Warm fingers. C. Pulses rapid. D. Paresthesia of the fingers. 75. Answer is D. At this time, pain beneath the cast is normal. The client's fingers should be warm to the touch, and pulses should be present. Paresthesia is not normal and might indicate compartment syndrome. Therefore, answers A, B, and C are incorrect. 76. The client with AIDS should be taught to A. Avoid warm climates. B. Refrain from taking herbals. C. Avoid exercising. D. Report any changes in skin color. 76. Answer is B. Herbals can prolong bleeding times or interfere with antiviral medications, therefore the client should avoid the use of herbals. A and D are not contraindicated for the client with AIDS. C is incorrect because there is no need to report all changes in skin color. 77. Which action by the healthcare worker indicates a need for further teaching? A. The nursing assistant ambulates the elderly client using a gait belt. B. The nurse wears goggles while performing a venopuncture. C. The nurse washes his hands after changing a dressing. D. The nurse wears gloves to monitor the 4 infusion rate. 77. Answer is D. It is not necessary to wear gloves to check the 4 drip rate. The healthcare workers in answers A, B, and C indicate knowledge by their actions. 78. The client is having electroconvulsive therapy for treatment of severe depression. Prior to the ECT, the nurse should A. Apply a tourniquet to the client's arm. B. Administer an anticonvulsant medication. C. Ask the client if he is allergic to shellfish. D. Apply a blood pressure cuff to the arm. 78. Answer is D. The client that is having ECT is given a sedative. When the blood pressure cuff is inflated, the fingers twitch when he has a grand mal seizure. A, B, and C are incorrect because there is no need for the nurse to take these interventions prior to ECT. 79. The 5-year-old is being tested for enterobiasis, pinworms. Which symptom is associated with enterobiasis? A. Rectal itching. B. Nausea. C. Oral ulcerations. D. Scalp itching. 79. Answer is A. Pinworms cause rectal itching. B, C, and D are incorrect because they are not signs of pinworms. 80. The nurse is teaching the mother regarding treatment for pedicalosis capitis. Which instruction should be given regarding the medication? A. Treatment is not recommended for children less than 10 years of age. B. Bed linens should be washed in hot water. C. Medication therapy will continue for 1 year. D. Intravenous antibiotic therapy will be ordered. 80. Answer is B. Bed linen should be washed in hot water. A is incorrect because special shampoos can be used by children under age 10. Answer C and D are incorrect statements, therefore, they are wrong.